Hello everyone, this is Dr. Zita Liu, an obstetrician and gynecologist specialized in infertility treatment. Today is December 8th, 2018. I'm going to present in vitro fertilization IVF process. A complete IVF process includes 5 steps. Step 1, preparation. Step 2, controlled ovarian stimulation. Step 3, egg retrieval. Step 4, egg fertilization, embryo culture, and/or freezing. Step 5, embryo transfer. For step 1 preparation, the couple will be counseled by the physician first and evaluated by the blood work and ultrasound. After the plan of IVF is made, the patient will start medications such as birth control pill to prepare for step 2, ovarian stimulation. In step 2, the patient will take medications such as injection or pills to have more follicles to grow bigger. Meanwhile, the patient will be evaluated by the blood work and ultrasound to monitor the follicle to grow and adjust the dose of the medication. When the follicles reach a certain size, they will be triggered by the medication to have the egg to finish the last step of maturity in the ovary. 34 to 36 hours after trigger, we're going to do step 3, egg retrieval. The egg will be retrieved from the follicle by retrieval needle under the guidance of ultrasound. In step 4, after the egg is collected, if the patient have no sperm or they want to preserve their fertility capacity for the future, the egg will be frozen. Otherwise, the egg will be fertilized. The embryo will be cultured to day 3 stage or day 5 stage. And the embryo will be either transferred in the same cycle if the patient is planning to have fresh embryo transfer, or the embryos will be frozen for the future in frozen embryo transfer cycle. Our goal is to achieve the pregnancy as soon as possible. Now I'm going to review the 5 steps in detail. The first step is preparation. In this step, the patients are going to receive their counseling, physical exam, blood work, radiology study, and then we'll start the medications for the preparation for next step. During their initial counseling, the couple's history, such as current and past medical history, surgical history, obstetrical and gynecological history, allergy, medication, social history, and family history will be collected. The high-risk factors such as age, pelvic surgery, inheritance will draw more attention. We also want to know the expectation of the couple. For example, how many babies they want to have in the future. What's their preference in the gender of the baby? Are they going to carry the baby by themselves or by surrogate? Are they going to use their own egg, donor egg, or are they going to freeze the egg? The patients are going to have the routine physical exam, besides the routine screening test requested by the regulation and guideline. The female patient also have the blood work to evaluate their ovarian function by 2 ways. The first way is by checking FSH, LH, estradiol, and progesterone level between day 2 and day 4 of their cycle. The second way is by checking blood AMH level at any date of their cycle. The most commonly used radiology study is ultrasound to evaluate the internal pelvic organ. From ultrasound, we can know the ovarian reserve by checking androgen follicle number between day 2 and day 4 of their cycle. We also know if there's any lesion in their ovary, fallopian tube, uterus, or any congenital defect. After we have all this above information, we're going to start the preparation by giving the medication such as birth control pill, estrogen, progesterone, or Lupron. The goal of this medication is have the hormone level in an optimal range, the size of the follicle synchronized, the number of the follicle reach the highest number before we start the cycle. They can also be used to modify the cycle. This medication can be given during luteal phase, after ovulation, or in follicular phase, before the ovulation. I prefer to give birth control pill in luteal phase. The second step is controlled ovarian stimulation. In the beginning of a natural menstrual cycle, multiple small follicles show up, but only one small follicle grows bigger and releases the egg. The rest of the smaller follicles are going to shrink. In a controlled ovarian stimulation in IVF, multiple small follicles can grow bigger for egg retrieval after receiving the medications. Among all these medications, the stimulation medication are most commonly used for the follicle to grow bigger. Gonal-F, follistim, Menopur are some of the most commonly used injectable medication for stimulation. Clomiphene and letrozole are two of the most commonly used oral medication for stimulation. In a controlled ovarian stimulation, when the follicle reaches a certain size, they'll be triggered by Overdrill, SCG, or Lupron for the egg in the follicle to finish the last step of maturity in the ovary before egg retrieval. In a natural cycle, the brain can sense the estrogen released by the growing follicle. When the estrogen reaches a certain level, the pituitary of the brain will release LH. About 40 hours after LH release, the egg will be released from the follicle in a natural ovulation. In a controlled ovarian stimulation, ganirelix and Cetrotec can be used to stabilize the pituitary and prevent the pituitary from LH release. We're going to do egg retrieval 34 to 36 hours after trigger. But some of the follicle can release the egg earlier than 34 hours. In order to prevent the follicle from early ovulation, ibuprofen can be given to the patient after trigger. Some of the patients have a higher baseline of FSH and LH. In order to suppress FSH and LH to a normal range, birth control pill or estrogen can be given to normalize FSH and LH level so that the follicle can grow bigger. In a controlled ovarian stimulation cycle, the patient are going to have multiple blood work and ultrasound evaluation so that we can know the patient response to the medication and we can adjust the dose of the medication in controlled ovarian stimulation. The third step is egg retrieval, 34 to 36 hours after trigger. The egg will be retrieved from follicle under the guidance of ultrasound by retrieval needle. The egg can be retrieved from vaginal approach and abdominal approach. Transvaginal egg retrieval is the most commonly used approach. Even though egg retrieval is a minimal invasive procedure, it still causes pain. IV sedation is the most commonly used anesthesia approach for egg retrieval. It delivers the medication to the vein, and the patient does not feel the pain due to the deep sleep. from the IVF sedation. Egg retrieval can also be performed under local anesthesia by giving the anesthesia medication directly to the vaginal wall. Among all of my egg retrieval, 81% is performed under local anesthesia. The fourth step is egg fertilization, embryo culture, and freezing. After eggs are retrieved, if the patient have no sperm for fertilization, or they want to preserve their fertility capacity for the future, the egg will be frozen. Otherwise, the egg will be fertilized by either mixing the egg and the sperm together or injecting sperm directly into the egg, called ICSI. The fertilized egg will be cultured to cleavage stage on day 2 or day 3, or blastocyst stage on day 5, day 6, or day 7. If a patient is considering to have pre-implantation genetic screening, the blastocyst will be biopsied. When we wait for the result, the embryo will be frozen. If a patient is considering to have fresh embryo transfer, the embryo can be transferred in the same cycle of egg retrieval, as long as they meet the requirement. Otherwise, the embryo will be frozen for the transfer in the future cycle. The fifth step is embryo transfer. When the embryos and uterus are ready, the embryos will be transferred back to the uterus under the guidance of ultrasound. According to the preservation of the embryo, the embryo transfer can be classified as fresh embryo transfer and frozen embryo transfer. The embryo can be transferred at cleavage stage and blastocyst stage. According to the protocol for endometrium preparation, the embryo transfer can be classified as natural cycle, hormonal replaced cycle, and stimulated cycle. Our goal is to have patients achieve pregnancy as soon as possible. The above information represents my personal opinion and is released for medical education to the public. If you have any specific medical question, please review it with your own physician. If you want to be counseled by Dr. Liu, please contact my clinic. If you want to review more education videos from me, please subscribe my YouTube channel, Dr. Infertility. Thank you.